Hello, YouTube family. This is Alex here from Banganta House German Shepherds. I haven't recorded in a while. My apologies. Things have been busy. I bred my girl Lucy to an outstanding Czech working line male, and hopefully everything took, and we will have puppies scheduled to be born between August 3rd and August 10th. A link to my website will appear if anybody's interested. Um, and that took priority for a dog breeder because breeding dogs is what a dog breeder does. And these puppies will be going to new homes in October. They'll be fabulous dogs for sports, active family companionship, and we hope to uh, find them very good homes. Today's topic is something near and dear to my heart since I'm a German Shepherd breeder, and that topic is Panosteitis, Pano for short. German Shepherds in particular, but other large breeds as well, have this disease, and it manifests itself as limping on one leg or another leg. Something fell in the background, as you can hear, whereby the dog all of a sudden becomes lame on one paw and starts favoring it, and then for a week it becomes one paw, and then a week after it becomes the other paw, and then it switches around and becomes the right paw again. My boy Winston, who is now 8 months old, who I imported from Germany, went through a round of that. X-rays are required by a vet to determine for sure if it's pano or not. So nobody really knows what causes this disease, but it's a disease of the long bones in the tibia and femur bones and other large bones in German Shepherds. Hi, Bailey. Hi, baby. Come here, watch the camera here. Hi, baby. Hi, Bailey. Okay, I don't know if you can see her. Okay, yes, baby. All right. I don't think she came out on camera because she's too low to be seen by the camera. So nobody really knows what causes this, but there's really not that many remedies for it. The best I can suggest to you is that this usually manifests itself between 6 and 8 months and fast growing puppies. And so what you want to do is you want your puppies to grow slowly, not quickly. You want to make them grow slowly. Now, this usually clears up between 12 to 18 months on its own. One thing the vet advised me is to basically be on puppy food, not be on adult food. What helps is glucosamine. I have new vet vitamins here. A link will appear below. These are the blue colored bottle as opposed to the green bottle. The green colored bottle is the more general purpose vitamin, and glucosamine, MSM, and chondroitin are in this bottle. I give it to my old girl Bailey. Okay, okay. And she is older, so her hips are affected because of age, not because of arthritis, but because of age. And so, yes, girl, yes, she wants to get in on the action. Yes, Bailey. Yes, sweetheart. All right, that's Daddy on camera. Okay. So the solution is to um, give the dog a supplement like glucosamine. A calcium supplement can help. Most likely, your dog will get a steroid, an anti-inflammatory. It's similar to ibuprofen in human beings, but it's called Rimadol. I don't know if the camera can pick that up. It's called Rimadol. So this is what would be prescribed by your vet. This seems to take care of the inflammation in the joint and relieve some of the pain that the dog is experiencing. Essentially, the bones are growing faster than the muscle tissue and tendons around the bones, causing a mismatch in the speed of the big bones growing versus the muscles which are supporting all that weight growing. So there's no cure for it except to give these anti-inflammatories, glucosamine, and calcium. Um, One thing I'd like to add is that it seems to affect male dogs more than female dogs. And one thing I'd like to caution you against, and this is something I believe in, is that I don't believe in castrating a dog before 2 years of age. In fact, in my puppy contract, if a person castrates the dog or does a hysterectomy if it's a female prior to 2 years of age, my hip and elbow guarantee is off. That's because when you remove the endocrine system in the animal, the only remaining part of the endocrine system is the pituitary gland at the back of the brain, and it's responsible for secreting growth hormone, which makes the animal grow. Without the other uh, organs, like the gonads or ovaries, to produce hormones, the animal has no growth to make the muscles grow because testosterone is responsible for muscle growth. So if you castrate the dog too fast at too young of an age, you're stunting their growth. It's not helpful. So if you want to fix your animal, that's your decision. Personally, I'm against it. I don't see any benefit to it. I think it's up to us to control our animals to prevent them from breeding without surgical methods. And I've had intact males and females living under one roof without any accidental pregnancies whatsoever. It's all about managing, not about surgery. So this is my beliefs, but you need the hormones for the bone plates to close. So if you castrate too young, I'm against it. Uh, Now, your job as a owner of a dog is to give it the maximum possible life expectancy. The maximum possible life expectancy comes from having an intact animal. So unless you have pyometra, which is an infection of the uterus, I see no reason to fix a female, or for that matter, fix a male, unless there's a medical reason to do it. In other words, doing it as a preemptive move on your part. Would you castrate a human being preemptively for no reason? And they have no voice except the voice you give them. In other words, they can't speak for themselves, so they are at our behest um, to treat them right. So don't fix them too young. But that's not directly related to this topic, but it is related to growth because the endocrine system is tied to growth. So, okay, guys, go to your vet, get an x-ray. You will get Rimadol. I don't know if the camera can spot that. Let me see if I can make that better. Hold on. Um, I don't know if you can see this package a little better. Rimadol. That does not come up on camera right. Okay, Rimadol. Can you see that? And New Joint Plus. I'm going to put a link because that camera is not focusing right. There we go. The camera now stopped zooming. So, all right. So, okay, guys. So that's my advice. It's temporary, although it looks terrible. It'll go away. Treat your dog right, guys. Give them vitamins. Give them love. Don't grow them too fast, and everything will turn out okay. Okay. Signing off. I hope this was helpful to you. Take care now.